Rushanara Ali.
Thank you, Madam Deputy Speaker. I want to start off by congratulating my honourable friend, the member for Brent Central, for securing this very important debate. The way in which different groups and different communities have been affected by this crisis, the coronavirus crisis, shows how scarred by inequality and social and racial injustice we are as a society. Coronavirus has laid bare the deep inequalities in particular faced by Black, Asian and minority ethnic communities and white disadvantaged communities also. It is truly shocking that Black and Asian and minority ethnic communities are more likely to contract the disease, with some groups, like those of Bangladeshi origin and background, twice as likely to be affected than their white counterparts. And as others have already pointed out, the Disparities Report highlights that other BAME groups are between 10 and 50% more likely to die if they contract coronavirus than their white counterparts. The evidence, Madam Deputy Speaker, is very clear. What we need is urgent action, and that's what's been lacking. The Public Health England report again showed, on top of the work that the ONS had done, the massive disparities and the dangers of those, particularly in certain sectors in frontline jobs. And of course, we've heard a lot about that in terms of the disproportionate impact on those working in the National Health Service, the dangers for those groups. And we've seen the toll that's taken for those who've worked in those sectors from BAME communities in particular. We mourn the loss of all those who've lost their lives, of all backgrounds, but this debate is about how we can ensure the government learns the lessons quickly to ensure that we don't continue in this appalling direction of further deaths and further fatalities. Since this pandemic began, in my constituency, Madam Deputy Speaker, with the highest number of Bangladeshi origin constituents and, of course, a sizable Somali community, week in, week out, my constituents have been mourning the loss of loved ones. In every part of our community, we have seen people having to deal with the fact that they've had to organise burials very quickly without being able to attend funerals together as a community. And I know that experience is shared by all of us across the country, and it's so painful. And those communities that have been hit the hardest, like the Black and Asian and minority communities and those from white disadvantaged backgrounds, have been hurt the most in our country. So we need to look at how we address these structural inequalities, how we address race and class discrimination in our country, if we are to learn from this appalling period in our experience as a country and ensure that we don't continue in this way. If there is anything that we can gain from what has happened so far, it's that we don't see the further loss of life. So moving forward, what we need is the government to look at some of the specific issues that affect BAME communities. That is severe overcrowding. That is the fact that there's a high prevalence of those from those communities with high levels of health inequalities. That is the fact that people live in intergenerational families that the government was too slow to see, even though we warned them. And that means greater investment in housing going forward. That means making sure that we deal with those structural inequalities around health inequalities, more investment in primary health care and prevention to protect different communities. But it also means making sure that as we ease lockdown, we do the risk assessments to protect those who are shielded, to ensure that those who have family members who are being asked by their employers to return to work, who are being shielded, are properly protected, or more people will die. And we need the government and ministers to learn fast as they move towards easing lockdown. Or what we will see is a double catastrophe of more BAME communities dying as we exit if it's not done properly and responsibly, and more people from poorer backgrounds facing death. I hope the Minister will reflect on the points that have been made today and act quickly.